My name is Carly Ketchum, and I am an FNP student at the Auburn University, and I'm filming my final head-to-toe assessment. I have nothing in my ears, and I'm going to do a full video for a room. Okay. Okay, and we will get started. So the first thing I'm going to do is wash my hands, make sure there is patient privacy, introduce myself to the patient. I'm Carly. I'm going to be your nurse practitioner doing your head to toe today. And I would normally have the patient in a gown, but for video purposes, we'll just pretend. Can you tell me your first and last name?
Garrett Morris.
Where are we?
Our house.
What is the year?
2023.
And why are you here?
To get an assessment done.
Okay, so the patient is oriented ×4. I'm going to ask you to remember 3 words, and we'll go over that at the end. Apple, bat, cat. Okay? So the first thing I'm going to do is my general assessment. So just looking at the patient, he appears his stated age and race. He doesn't appear to be in any distress. He is dressed appropriately. And he is clean and groomed. So the first thing I'm going to do in my assessment is my cranial nerves. So I'm going to start with cranial nerve 1. Can I have you occlude one of your nostrils and breathe in? Okay, so I would do that, bilaterally. And his nares are patent. I'm now going to have you close your eyes and tell me what you smell.
Alcohol.
Good. So I would do that bilaterally, so cranial nerve 1 is intact. The next thing I'm going to do is assess cranial nerve 2, his visual acuity. For that, I would use a Snellen chart. Normally, this would be 20 feet away from the patient, but for demonstration purposes, I'm going to hold it right here. Can you please read the lowest line?
LTFPH.
Right, so that is 20/20 vision. If he had 20/40 vision, that would mean he could see at 20 feet, but a normal person could see at 40 feet. The next thing we are going to do is I'm going to test your fields of vision. Can you please cover one of your eyes? Okay, and I want you to tell me when you can see my fingers.
No. No. No.
Okay, good. So cranial nerve 2 is intact. The next thing we will do is test cranial nerve 3, 4, and 6. So I'm going to have you follow my finger without moving your head with your eyes. Good. So there was no nystagmus noted. The next thing I'm going to do is have you focus on something over my shoulder while I shine this light in your eye. Good. So pupils are equal, round, reactive to light bilaterally. I would also do the confrontation test bilaterally. Okay. I'm now going to test cranial nerve 5. So I am going to have you clench your jaw while I palpate your temporal and your masseter. Any tenderness?
No.
Good. Okay, the next thing, well actually, with cranial nerve 5, I'm also going to test the sensation of your face. Can you please close your eyes? And I want you to tell me if you can feel sharp or dull.
Sharp. Dull. Sharp. Sharp.
Okay, so cranial nerve 5 is intact. The next thing we'll do is cranial nerve 7. Can you raise your eyebrows, puff out your cheeks, smile, and close your eyes and don't let me open? So cranial nerve 7 is intact. The next thing we'll test is cranial nerve 8. So I'm going to perform the whisper test, and I would normally do this bilaterally. Can you occlude one of your ears and tell me, I'm going to whisper something, tell me what it is.
Cat. Dog.
Good, so he got that right. I am now going to perform the Weber test. So I'm going to put this on top of your head, and I want you to tell me if you can hear it in one ear or both.
Both.
Good. I'm now going to perform the Renee test. I'm going to again strike this and put it behind your ear, and I want you to tell me when you can no longer hear it. Oop. Dark.
No.
Okay, now tell me when you no longer can hear it in front of your ear.
No.
Good. So that is a normal finding because air conduction is greater than bone conduction, and I would do that bilaterally. I'm now going to test cranial nerve 9 and 10. Can you open your mouth and say, ah?
Ah.
So the uvula is midline and rises and falls symmetrically. At this time, I would also test his gag reflex, where I would touch his uvula with a tongue blade to elicit the gag response. I'm now going to test cranial nerve 11. Can you shrug your shoulders and turn your head against my hand? Good. So cranial nerve 11 is intact. I'll now test cranial nerve 12. Can you stick your tongue out? Move it up and down and side to side. Good. So that concludes our cranial nerve assessment. I'm now going to move on to my head assessment. So looking at the patient's head, I don't see any visual deformities. His skin is clear, warm and dry. There's no pallor noted. I'm going to palpate his scalp. Any tenderness? Good. I don't feel any masses. Looking at his scalp, I don't see any alopecia or hair loss. His hair is clean and dry. The next thing I am going to do is palpate his TMJ. Can you open and close? Good. So there's no popping or clicking noted. I'm now going to palpate the frontal and maxillary sinuses. Any tenderness?
No.
Any tenderness?
No.
Good. And now I'm going to go through the lymph nodes, starting with the preocular, postocular, occipital, peritonsillar, submandibular, submental, supraclavicular, and infraclavicular. Any tenderness?
No.
And I did not feel any swollen nodules. So I'm now going to start with his eyes, inspecting his external eyes. His eyebrows and eyelashes have normal hair distribution. His conjunctiva is pink, sclera is white. His iris is blue. I don't see any redness or swelling or drainage. I'm going to palpate the lacrimal ducts. Any tenderness?
No.
Okay. I'm now going to look inside of his eye. I would normally do it bilaterally, but I'm only going to do one for right now. Okay, if you want to focus on something behind me, I'm just going to look in your eye. So I can see the red reflex. I can see the macula, the fundus, the optic disc, the blood vessels, and there is no redness or swelling noted. The next thing I am going to do is inspect the ears. Sorry, it keeps going black. So they're symmetrical on the head bilaterally. There's no deformities noted. I'm going to palpate the pinna, the tragus in the pinna. Any tenderness?
No.
And I didn't feel any masses. I'm now going to look inside the internal ear. and I am going to pull up and back, supporting his head. Okay, so his optic disc is pearly gray. He has a moderate amount of earwax. I don't see any redness or swelling, drainage noted in his ear, and I would do that bilaterally. The next thing I'm going to do is inspect his nose. His nose is symmetrical on his face with no deformities noted. I'm going to palpate any tenderness. I don't feel any masses. I can move his nose. I'm now going to inspect the nose. If you can look up. So there's no deviation in his septum. His nares are symmetrical. I can see his turbinates. He has a little bit of hair in his nose. There is no redness, swelling, nothing occluding his nostrils. The next thing I'm going to do is inspect his mouth. His lips are pink with no cracking. Can you open your mouth? So his dentation is intact. He has no gingiva. His tongue is pink. Can you lift your tongue? So his hard and soft palate are intact. You can go. The floor of his mouth isn't red. His uvula is midline. He has no tonsils, and his posterior pharynx doesn't have any postnatal drip. Okay, let's see. I'm now going to inspect his neck. So looking at his neck, I don't see any deformities. The skin is dry. I'm going to palpate it. Any tenderness?
No.
Okay. His trachea is midline. I'm now going to go behind and palpate the thyroid. Can you take a deep breath? Oh, sorry, I mean swallow. Okay, so there were no nodules noted in the throat. I'm now going to test range of motion in his neck. Can you lean your head side to side? And then front and back. So he has full range of motion of his neck. Okay, so the next thing I'm going to do is my cardiac assessment. He would normally have his shirt off, so just looking at his skin, it's dry, warm. There's no redness. His hair distribution is normal. I'm feeling his upper extremities. They're also warm and dry. There's no edema noted. Looking at his hands, again, no edema or redness. They're warm. Capillary refill is less than 3 seconds. Move the camera down. Looking at his lower extremities, they're also nice and warm and dry. There's no swelling noted. His feet are a little cold, but there's no swelling. Testing his capillary refill, which is less than 3 seconds. And I would do that bilaterally in both the upper and lower extremities. I'm now going to palpate his pulses. Well, first I'm going to look at his neck. Can you please turn your head that way? So looking at his neck, I don't see any distension or visible JVD or pulsations or distension at this time. I'm now going to palpate his pulses. I would do this bilaterally, starting at the carotid, and then the radial, the popliteal, the dorsalis pedis, and the posterior tibial. So those are all 2+ bilaterally with a normal rate and rhythm. I'm now going to listen to his heart. I would auscultate with my diaphragm, listening for any abnormal heart sounds, making sure I can hear S1 and S2. I'm also going to listen with my bell, listening for any type of murmurs that I could hear. So I am going to start at the aortic, which is the second intercostal space on the right side. The pulmonic, which is the second intercostal space on the left side. Erb's point, which is the third intercostal space. The tricuspid, which is the fourth intercostal space. And the mitral, which is the fifth intercostal space at the midclavicular line. And I would do that with my bell. So I hear normal S1 and S2, no murmurs or additional heart sounds. I'm now going to palpate my PMI. So I'm going to feel at the midclavicular line at that fifth intercostal space. And I'm going to have my patient lean forward so I can palpate that PMI. Okay. I'm now going to move on to my respiratory exam. I'm going to start looking at the anterior chest. I'm looking at his breathing. His rate and rhythm is normal. He doesn't appear to be in any distress. Skin is nice, warm, and dry. Can I have you lift your arm? So looking at the lateral aspect of the chest, his AP ratio is 1:2. I'm now going to osculate his lung sounds. I'm going to do one side of his chest, anterior and lateral, and I would also do it bilaterally. And I'm going to ask him each time I move my stethoscope to take a deep breath. Okay, so I don't hear any crackles, any wheezing, lung sounds are clear, and the anterior chest bilaterally. I'm now going to move to the posterior chest. So inspecting the chest, his shirt would normally be off. Sorry. His skin is warm and dry. There's no redness or swelling noted. I'm now going to listen. Can you turn her face that way? I'm now going to listen to the posterior chest. I would listen normally bilaterally, so I'm going to listen to the posterior and the lateral. And I would normally have the patient take a deep breath every time I move my stethoscope, but for this exam, I'm just going to move it. So lung sounds are clear with no wheezing or crackling heard. While I'm at the back, I'm now going to palpate the back for any tenderness. Any tenderness?
No.
I'm going to percuss from the apex to the bases, listening for any dullness. I would do this bilaterally. So there is no tenderness heard. I'm now going to test tactile fremitus. So I'm going to put my hands and have the patient say 99.
99. 99.
So I can feel the vibrations equally on both sides. I'm now going to test respiratory expansion and symmetry by placing my hands under the 10th ribs. Can you take a deep breath? Good. So my hands rise and fall symmetrically. I'm now going to palpate the spine. Any tenderness?
No.
Good. And I'm going to percuss for CVA tenderness bilaterally. Any tenderness?
No.
Good. So the next thing we are going to do is test range of motion of the spine. If you want to stand up and face the camera. Can you lean forward, lean backwards, reach your hand down and go side to side, and can you twist? Good. Good. So he has full range of motion of his spine. I am now going to have you lay down. And I'm going to continue my cardiac exam. So with the patient laying, I'm going to have him look towards the wall at a 30 to 45 degree angle. I'm looking for any jugular vein distension, which I don't see. No distension, no pulsations. I'm now going to palpate the hepatojugular reflex. So that is a normal finding where he now has no JVD. I am going to go ahead and listen again to the 5 parts of the heart discussed earlier with my bell and stethoscope. Again, listening for any murmurs, S1, S2, or additional heart sounds. At the aortic, pulmonic, Erb's point, tricuspid, and mitral. While I'm here, I'm going to use the bell of my stethoscope to listen to any bruits. I'm going to listen at the aorta, the renal arteries, the iliac arteries, and the femoral arteries. So I would do that bilaterally, and I do not hear any bruits. So now I'm going to start, I'm actually going to bring you a little closer so we can do our abdominal assessment. Okay, so I am going to start by inspecting the abdomen. It's flat, there are no masses, there's no distension, there's no pulsations noted. I am then going to auscultate, listening in all 4 quadrants for bell sounds, using my diaphragm. Okay, so I can hear bell sounds in all 4 quadrants. I'm now going to percuss all 4 quadrants. So I do hear tympany. I'm now going to percuss the liver, starting at the bottom and moving up until I hear dullness. Okay, and then I would mark that spot and move up in between the intercostal spaces, moving down until I hear dullness. Okay, and then I would measure that. His is about 9 centimeters, which is normal. So I've already percussed the abdomen. I'm going to start with light palpation, looking for any guarding or grimaces. Any tenderness?
No.
And then I'm going to move on to deep palpation. Any tenderness?
No.
Good. I'm now going to palpate the kidneys, which I can feel. I'm going to palpate the liver. Can you take a deep breath? So I can feel the liver. I'm going to palpate the spleen. Can you take a deep breath? And I can't feel the spleen, which is a normal finding. So I am now going to move you back a little bit. I am going to test sensation in his upper and lower extremities. Can you close your eyes? You feel me touching you? Mm-hmm. One or both?
Both.
About then here?
Yes.
And here?
Yes.
Okay. I'm now going to do the test with sensation. If you want to close your eyes and tell me if it's sharp or dull.
Sharp. Dull. Sharp. Dull.
Good. So he has sensation of his lower and upper extremities. While I'm here, I'm going to go ahead and palpate his hip, knees, ankle, and toes. I'm going to palpate the joints of that for any edema, bony abnormalities, fluid, tenderness. So I'm going to start with the hips. Any tenderness?
No.
Go to the knees. Any tenderness?
No.
The ankles. Any tenderness?
No.
The toes. Any tenderness?
No.
Okay, and I didn't feel any edema or bony abnormalities. Now I'll do that bilaterally. I'm going to bilaterally assess his range of motion of his lower extremities, but I'm only going to do one for the video. If you can lift your leg up, bring it in towards you, out towards you. Can you bend your knee? Extend your knee. Good. Actually, can you bend your knee again? And in. Bend it your down. And out. Good. Moving to the ankles. Can you move them in a circle? Can you bend down, up, side to side? Your toes, can you extend and flex? So he has full range of motion of his lower extremities. I'm now going to test his strength. Can you lift against me? And push against me? Good. So he has 5 out of 5 strength bilaterally in his lower extremities. I'm going to have you go ahead and sit up. And we're now going to test or palpate his upper extremity joints. I would normally do this bilaterally, but I'm just going to do this side. Again, feeling for any bony abnormalities, any fluid, any swelling, any tenderness of the shoulder, any tenderness of the elbow,
No.
any tenderness of the wrist,
No.
and any tenderness of the fingers.
No.
Okay, and I didn't feel any fluid, bony abnormalities, or edema. We're now going to test his range of motion in his upper extremities. If you could lift your hand all the way up, hyperextend all the way back. Can you bend your arm behind your back? Good. I'm now going to have you lift your arm up. Can you bend your arm, extend your arm, go out, in, cross, and then bending your arm. Can you bring it in and out? And then I'm going to have you lift your hand with your hand up and down. Bring your wrist this way and that way, up and down. Flex your fingers. Good. So he has full range of motion and his shoulders, elbows, wrists, and hands bilaterally. I am now going to assess his reflexes, starting with his upper extremities. So I just want you to let your arm hang limp, and I'm going to assess his tricep. And now if you want to turn your arm around, his bicep, his brachioradialis. Okay, and I'm now going to have you come and sit on this chair so we can assess our lower. Okay. His patellar, his Achilles, and his Babinski with this side. Good. So his reflexes bilaterally are 2+. And I'm now going to test his grip strength. Okay. He has 5 out of 5 grip strength, strong and even bilaterally. I'm now going to test his upper arm strength. If you want to go like this, push against me, pull me towards you. So he has 5 out of 5 strength bilaterally. Let's see. Take a minute, make sure we've gone through everything before we start our neuro exam. Ears. Okay, I think we're ready to start our neuro exam. So looking at the mood and affect of the patient, it's appropriate for the situation. He's answered all my questions appropriately and behaved appropriately. I'm now going to test his reasoning. Can you tell me what would happen if your house was on fire?
Get out of it.
Okay, and what did you do yesterday?
Worked on a computer.
And what were those 3 words I wanted you to remember?
Bat, cat, and apple.
Good. So his recent memory is intact. I'm now going to have you close your eyes and tell me what I place in your hand.
Cotton swab.
Good. So stereogenesis is intact bilaterally. I'm now going to have you close your eyes, and I'm going to draw a letter in your hand, and I want you to tell me what it is.
S.
Right. So graphesthesia is intact bilaterally. We are now going to test his fine motor movement and coordination. Can you run your heel down your shin, starting up there? Now can you do it on the other side? Good. Now can you put your arms out and touch your arm while you speed up with motion? Good. And now I'd like you to touch your nose and touch my finger. Again, speeding up. Good. So his fine coordination and movement are intact bilaterally. I'm now going to perform the Romberg test. If you would stand up for me. Can you hop on one foot? Good. And now I'm going to have the patient close. Sorry, that light. I'm going to have the patient go that way. Close his eyes to test the other part of the Romberg test. So you want to close your eyes. So he doesn't sway at all, and I would normally do that. You can open your eyes for a minute. The next thing I'm going to do is test the patient's gait. So I'm first going to have you walk normal across. Okay, and can you do heel to toe? Can you walk on your tippy toes? And can you walk on your heels? Good. So he was able to perform all of those different types of gait. There was no limping noted or no difficulties there. If you want to take a seat. The next thing I'm going to explain is a self breast exam. So you want to make sure you teach your patients to do this at the same time every month after their period. Usually in the shower is the best. You're going to have them, I'm going to demonstrate on Garrett, you're going to have them start up by the armpit, and they can go zigzag, they can go around, and you want to make sure that you are feeling all the lymph nodes for any type of masses, tenderness. You want to be examining the breast for any nipple inversion, nipple discharge, dimpling, and they would want to see their healthcare provider. If I was doing a clinical breast exam, I would have the patient put their arm up and behind their head and supporting their shoulder on a pillow. I would again do the same breast exam, starting around the elbow and moving all the way around the lymph nodes, feeling for the same things. Another way is to have the patient put their hands on their hips and lean forward. Doing that, you're testing for any dimpling, you're looking at symmetry. And again, having the patient do it at home and feeling their breasts because they know what their normal breasts are. Okay, I'm just going to make sure I've gone through everything. Again, just looking at my patient, assessing his skin. So we've done head, ears, eyes, nose, mouth, throat. Okay, so that is the end of our final exam. Or sorry, our head to toe. Thank you.